Thank you all for coming this evening. My name is Nima Hussain. I should have introduced myself first. Welcome to this Zero COVID event. We have a great lineup of speakers this evening. The theme is the virus isn't going away, so neither can we. The virus clearly isn't going away. We have tens of thousands of new cases daily, over 1,000 new hospitalizations a day, and new deaths running at 1,000 a week. Boris Johnson reportedly said up to 50,000 annual deaths would be acceptable. We disagree. We think that is 50,000 too many. As one of our speakers at a previous meeting said, we don't have a policy to tolerate fires. We have a zero fires policy. This doesn't mean that there are never any fires. It does mean we always suppress them. We should have the same approach to the virus. Our first speaker this evening requires very little introduction. Is the co-convener of the Zero COVID campaign and Hackney MP, Diane Abbott. Diane will outline the theme of this meeting and how we continue to work with others to build support for measures to suppress the virus. Diane? Sorry, Diane, you're muted.
Thank you very much, Nemo. Can you hear me now?
Yes, Diane, we can hear you.
Good. To the audience, I would like to say thank you all for coming here this evening. And I'm delighted that we have such a strong panel of speakers. I am sure we can all learn from them. I know that I will. Among the many distinguished guests tonight, I want to pay a particular welcome to the First Minister of Wales, Mark Drakeford. We know how busy he must be, and so I want to thank him on behalf of the entire Zero COVID Coalition for making the time to join us this evening. Our theme for this evening is, the virus isn't going away, so neither can we. I know that the first part of that statement ought to be self-evident, but we are living in a time when truth is becoming a scarce commodity. Not that long ago, we had an unnamed government minister quoted as saying that the pandemic was, and I quote, all over bar the shouting, unquote. Those words must ring very hollow in the ears of all those who have contracted the virus, become seriously ill with it, including with long COVID. And I dread to think how those words must sound to those who have lost loved ones since that statement was issued. But the government acts as if the minister's statement is true, denying mitigations in schools and workplaces and at public events. The result is that for a period, Britain had more cases than most countries in Western Europe put together. We also have rising numbers of deaths, when many other countries are seeing their death rates falling. And now we have severe pressure on the NHS at a time when we are going into the flu season. Currently, we have more than 1,000 hospitalisations a day. And all of this before the winter flu season has even properly begun. But that is why the second part of our meeting's title tonight is also valid. We cannot go away while thousands of people are getting seriously ill and even dying, while the NHS is under such strain, and while Boris Johnson is in fact, quote, letting the bodies pile higher, end quote. Now, some of our speakers tonight don't agree with the demand for zero COVID, yet I'm delighted that they have nevertheless agreed to speak. It's always been the case that some people that support our organisation don't necessarily believe in absolutely zero COVID. But we have never put a barrier up to prevent people who perhaps only want to speak about improving the situation or want to talk about a specific section of society or who represent a certain body of people. As far as we are concerned, they are all very welcome. Every step in the right direction is a welcome step and will help save lives. Any demands that benefit one group, such as long COVID sufferers, or workers in one sector, or children, or Black and minority ethnic people, will benefit us all. At the same time, we are not giving up the fight for zero COVID. All around the world, there are enormous pressures against campaigners, but also against medical and scientific communities, or even pressures on elected governments to adopt the disastrous policies which are currently in place in the United States and in Britain, and which have led to a public health catastrophe. These pressures must be resisted. We cannot and should not learn to live with the virus. This has only led to big death tolls. The Economist magazine, scarcely a far left publication, estimates that the global total of deaths from COVID is now around 16 million. Nor can we allow a form of vaccine apartheid where rich countries hoard vaccines, even to the point where the vaccines are unusable, but billions of people in the global south remain unvaccinated, and the share price of the big pharma companies goes through the roof. So we want the broadest possible zero COVID coalition, working with everybody who wants to make a difference, and we will continue to argue for zero COVID, the only proven method of suppressing the virus that has worked anywhere in the world. So thank you all, and I'm very much looking forward to listening to our speakers. Thank you very much.
Thank you very much, Diane. Thank you. Our next speaker is Richard Bergen MP. Richard is a stalwart of the campaign and has spoken regularly at previous meetings. Richard can outline to us what the overall picture is on the spread of the virus, the government's failings, and what can be done as an alternative. Richard?
Well, thank you very much, and apologies that shortly after I've spoken I'll have to leave, so I've got to get the train down to London from my constituency up here in Leeds. And thanks for inviting me to this event. I think it's important, as Dan said, that we continue to highlight the ongoing failings of the Boris Johnson government, that we continue, crucially, to offer an alternative, because for too long, the UK government has been acting as though the pandemic is over, acting as if COVID is no longer a threat. Government ministers have behaved as if vaccines alone remove the need for any other public health interventions. Now, a few basic facts highlight just how wrong they are and just how urgent the situation is. Over the past month, the UK has had the world's second highest number of new cases. That's over 1 million new cases. We've also had the world's second highest number of hospitalisations. That's double the number the next highest country, Germany, and 4 times higher than France. The UK has slipped to around 12th in Europe for vaccination rates, with the government especially slow at vaccinating teenagers. Most seriously of all, over the last month, the average daily COVID death figures are equivalent to over 45,000 deaths per year. Now, in October, we had more or less the same number of deaths in 2021 as we did in 2020 when there were no vaccines. Now, this isn't normal. The UK has around 3 times the rate of deaths of France, Germany, Spain, and Italy. Yet Sajid Javid sickeningly labelled the current death rates as, and I quote, mercifully low, mercifully low. There's a deliberate attempt to play down the public threat. The current unnecessary and deadly delay in acting is what we've seen throughout this crisis. Many tens of thousands of deaths would have been avoided if the government hadn't refused to act in line with what scientists were calling for. Boris Johnson's government has repeatedly put profits before public health. Now, we know there is no time to delay because the government's own chief scientific advisor previously said, the lesson is go earlier than you think you want to, go harder than you think you want to, and go a bit broader than you think you want to in terms of applying the restrictions. So acting now can reduce huge pressure on our National Health Service, which already has hospital occupancy rates far above the recommended safe level, and that's months before the normal winter peak. This is now forcing people facing medical emergencies to wait even longer to be seen. So nobody is now suggesting a new lockdown is necessary. In fact, the only thing that makes a lockdown more likely is the government's current inaction and its failing strategy. What the government must do is urgently introduce the effective public health measures that many other countries are already benefiting from, requiring masks on public transport and in shops, improving ventilation in workplaces and working from home where people can, with subsidies and loans to businesses to get this rolled out ASAP. A strategy to tackle infections in schools. The government should immediately implement the action plan the teaching unions have developed, and proper sick pay so workers aren't forced into work when they're ill. That can all work to keep cases much lower. So COVID has overwhelmingly been a disease of the poor, of Black communities, of disabled people, and of the marginalised. It's low-paid workers on the front line that have been at the greatest risk of dying in this crisis, with figures suggesting they're 3 times more likely to lose their lives. The government's continued refusal to offer decent sick pay has entrenched those deep inequalities that have led to such different experiences of this pandemic. So one of the key issues that we must all keep campaigning for is the TUC demand for sick pay at real living wage levels. Another key issue is the government's insistence on handing sections of the COVID response over to the private sector. This has been a disaster for the public, although a very lucrative opportunity for the friends and backers of senior Tory ministers. The latest scandal of tens of thousands of people being incorrectly told their COVID test was negative due to errors at a private lab is just the latest in a long line of failures driven by the government's ideology of private good, public bad. If the government insists that we learn to live with the virus, then surely the least people can expect is that there's a fully functioning, publicly run test and trace system, not one that is being used to line the pockets of Serco shareholders. So in conclusion, it's time for the Prime Minister and his government to admit they got it wrong and, much more importantly, to change track and implement the public health measures urgently needed to keep people safe and save thousands of lives. And to end, I just want to say one thing about international access to vaccines and international cooperation, especially given the COP26 climate talks. We cannot respond as ineffectively to the climate crisis as we have done to the COVID crisis. The global response to COVID has been shameful, with absolutely unacceptable COVID-19 vaccination rates in developing countries. Our government is at the heart of the international lobbying to prevent the vaccine patent being waived. This is the main reason that poorer countries have inadequate vaccines. Just 1% of people living in low-income countries have been fully vaccinated, and just 3% have even had 1 dose of a vaccine, while 84% of all doses that have been administered so far have all gone to people in high and upper middle income countries. So it's essential that just as we fight to change the government's position at home, we also fight to change its position abroad by pushing our government to waive the vaccine patents so that countries can manufacture their own vaccines. That really is our duty. Thank you.
Sorry, thank you very much, Richard. Thank you. I'm now delighted to introduce another stalwart of this campaign, my good friend and brilliant campaigner, Belle Ribeiro Addy MP, the Member of Parliament for Streatham. Belle will talk about the overall situation in this country, the roots of the resistance to a logical policy on suppressing the virus, and where we go from here as a campaign. Welcome, Belle.
Thank you, and thank you so much for inviting me to speak. My apologies if you hear any strange noises. I've snuck out of the chamber at the moment, and I think it's so important that we're continuing to have these meetings, because the overall picture is still quite grim, but because we're not hearing it as much in the press. Perhaps it may not seem that way. In this country, the R rate is now between 1.1 and 1.3. So all of the nonsense about a trend and a fall in new cases is just that, it's nonsense. In the southeast, it's even higher. Worse now, there are over 100,000 new admissions to hospital every day, and the number of people in hospital because of the virus also continues to rise. And at this rate, we could soon be back above levels last seen in February when we were still in lockdown. And obviously, I cannot stress the amount of pressure this is putting on our National Health Service. There are also now over 5.7 million people on the NHS waiting list. Of course, this is not solely because of the pandemic, far from it. In 2010, when the Tories won the election, there were just about 2.75 million people on the NHS waiting list, and this has risen every year before the pandemic. So this is a long-term effect of Tory policies of underfunding and privatisation. But the waiting lists have now doubled, and the NHS is quite literally in danger of toppling over. The situation on new deaths is also equally grim. We are now firmly established as the COVID death capital of Western Europe. We have seen a weekly death toll which is greater than France, Spain, Belgium, and Italy combined. And the main difference with those countries is they have the most minimal measures, such as mask wearing in schools, precautions about gathering indoor spaces. I mean, that's all. And I want to shortly say where I think this terrible policy comes from, these terrible Tory policies. But I also want to say a few words first on the budget, just in case I don't actually get to say them in there. But this might seem a bit off the point, but illness and disease thrive on poverty. And we know that the virus attacks the population unevenly. In particular, it's hit disabled people so hard, as well as elderly, Black, Asian, and minority ethnic communities have been hit hugely, disproportionately. So the budget should actually be highly relevant. But what the budget has done is exacerbate all the pre-existing inequalities in society. Among others, women will be the biggest losers from this budget. A gender audit of Wednesday's announcements by the House of Commons' own library shows that 27 million women will be disproportionately affected. Their research shows that the average British woman over 18 will be £1,800 worse off over the next 6 years because of the Chancellor's tax rises. And those who are older will be hit with 2,500 less in their pension benefits. The research actually goes further. It shows that low-income households will be disproportionately hit, and that disabled people and people from minority ethnic groups are more likely to be in those low-income households. Now, all this does is highlight a key aspect of this government's policy. It could have actually used this budget to address some of the inequalities that have arisen or deepen in the pandemic. Instead, they've gone on to adopt policies which can only make those inequalities worse. In fact, they've consciously used the pandemic to pursue nothing short of a vendetta against ordinary people. So fire and rehire was virtually unknown in this country for decades until the pandemic arose. And last week, there was an opportunity in Parliament to outlaw the practice. But what the government did was to block the bill that would have achieved that. And they're facilitating fire and rehire and essentially given a green light for it to go ahead. In exactly the same way, they've cut environmental standards, ramped up privatisations, wasted billions on failed equipment during the pandemic, and it's all gone to the private sector, including cronies and Tory party donors. And it's just been a huge bonanza for them. And this has been the government's approach throughout. It's denied that Dominic Cummings summarised government policy as protect the economy and who cares if a few old people died. But this denial was actually made less convincing by the fact that it does neatly sum up what this government's policy has been. And although what they mean by the economy is their cronies, although what they actually mean by is their cronies and donors and how much money they're actually making. And what they actually mean by a few old people turns out to be over 160,000 dead, many of them disabled people and disproportionately from ethnic minorities. So if anybody ever asks why we continue to battle against the odds on this campaign, remember Cummings' phrase and say to yourself, well, I do care if people die. But why exactly are we battling against all the odds? Well, all logic, when all of the logic and the serious medical and scientific evidence is for much earlier, much more stringent and much more comprehensive measures than we have ever had in this country. More than 18 months in, and we have never had a test and trace system that is worthy of the name, despite spending 37 billion on it. And when I challenged the cost on it. Somebody actually once said to me, well, you know, the thing about technological systems is that it sometimes can take a while to make sure they work effectively. But in my view, you spend £37 billion on something to make sure that you don't have any of these technical issues. But that might be, well, not just me, probably all of you too. Now, there's a big question, who benefits? The clue is in the description. It was a 37 billion test and trace system that failed, or we can see how many contracts have gone to the private sector. The NHS was better and more able to do it cheaper. So again, a private sector bonanza. Or we can see if the share price of big pharma companies, the shares of AstraZeneca or Pfizer or Johnson & Johnson and Moderna and the rest have all performed hugely better than their relevant stock markets. There is a reason why they refuse to waive patents, and the reason why Western governments who back their interests refuse to allow vaccine patent waivers. They and their shareholders are enjoying a financial bonanza throughout this pandemic. So this explains why it's such a difficult fight and why it will be such a prolonged fight. There are very powerful vested interests rallied against us, and it's not just the pandemic that's offered this bonanza from some companies. It's others that are benefiting too. Homelessness is increasing as evictions increase. Landlords are taking advantage of the crisis. Firms are firing and rehiring, or they tell those working from home they must work for the time they would normally spend traveling with no extra pay, or other workers have just had their hours slashed or unpaid, overtime is demanded. And we know that to distract from all this, racism is on the rise, racist hate crimes are on the rise, while the government continues to demonize refugees and pursues culture wars. It's a government that denies institutional racism even exists, even while increasing institutionally racist policies such as stop and search. All of this and the attacks on women are designed by the government as distraction from the consequences of their own terrible policies. But this then informs how we respond to the government's reckless and lethal policies. They have very, very powerful forces as allies and represent very powerful forces, so we have to too. We have to ally with every campaign that opposes even a small aspect of the government's policies related to COVID, whether it's the striking DVLA workers or campaigners for vaccine justice, or fighters for health and safety, or against privatisation, or against racism, or long COVID campaigners, all of these and many more. And we have to reach out potentially to all those who will come part of the way with us, even if they're not prepared to make the whole journey to zero COVID. And we, those of us involved in the Zero COVID Coalition, will never stop arguing for zero COVID until somebody shows us you can suppress this virus any other way. And no one yet, and no other country has done that yet without zero COVID. Thank you very much.
Thank you very, very much, Belle. It is my great pleasure now to introduce our next speaker, who is Mark Drakeford, First Minister of Wales. The First Minister, among his many other duties, has taken up the issue of how to deal with the virus in a different way to the policy being pursued by the Westminster government. He will be able to outline the overall situation in Wales and why his government have adopted a different course. Welcome, Mark Drakeford.
Well, thank you very much indeed. I hope you were able to hear me. Thank you for the invitation. Thank you particularly to Diane Abbott for putting the invitation to me in the first place, and for all the support that she has been to us in Wales and to the Labour government that we have here. I'm going to begin by just being clear that coronavirus has certainly not gone away in Wales. Our numbers are far too high. The vaccination programme has amended the link between falling ill and hospitalisation, but not eliminated. And the number of people who are falling ill in Wales means that about half our critical care beds are occupied today by people suffering from coronavirus. And when you have a number of people falling ill in the community from coronavirus, short of hospitalisation, that itself does enormous harm. It does harm in the lives of those individuals. It means they can't be in work, they can't be in school, they can't go about their daily lives, and it has an economic impact as well on the ability of Welsh businesses and Welsh public services to go on providing the sort of work that they would normally expect to be able to carry out. We say as well that the whole experience of coronavirus has been a very difficult one here in Wales. We have thousands of families who have lost a loved one, and the virus has cruelly exposed the underlying inequalities that there are in Wales as well as elsewhere in the United Kingdom after 40 years of the neoliberal experiment. So the impact of coronavirus is felt, as you've heard already, more powerfully in the lives of people from disadvantaged backgrounds or BAME communities than across the community as a whole. Now, I think if I was to make just one claim for the way in which the Welsh Government has gone about the task of trying to manage the impact of the pandemic in Wales, it would probably be that we have managed, despite the enormous difficulties, to keep the bulk of Welsh public opinion alongside us in the way that we have gone about that task. So I'm in Glasgow this afternoon. We travelled up from Cardiff today. I was standing on Crewe Station in the middle of England, and somebody came up and said to me in Welsh, "Diolch am popeth chi wedi wneud I cadw Cymru yn ddiogel." Or in English, thank you for everything that has been done to keep Wales safe during the pandemic. And that sense that by the collective effort of everyone in Wales, that we've used our powers to keep Wales safe, I think is still the way in which most people in Wales look back on that experience. In that, we have taken a different view from the UK government on many specific aspects, but probably more importantly, our general approach has been more precautionary. We have been more cautious. We have kept restrictions in place for longer. We have taken some actions that haven't been taken, particularly by the government in England. And we've done all of that not ever for the sake of being different, but because we believe we have genuinely followed the evidence and the advice we have from our Chief Medical Officer and from SAGE, amongst others, that we have shared that information with Welsh citizens. I do, at the moment, a press conference every 3 weeks. I was doing them twice a week at the worst days of the pandemic. And the purpose of my press conferences are to make sure that we share with the Welsh public the information that our cabinet has had and has led us to our conclusions. That's not because people always agree with the conclusions we've drawn, but without sharing information with people, I don't think they have a proper opportunity to try and have that insight into the way decisions on their behalf are being made. And then finally, we rely upon the sense of social solidarity that we are lucky enough still to have in Wales, and which has been the cornerstone, really, of the way in which we have acted together to try to keep Wales safe and to keep Wales open during the last 20 months. So along the way, we have made those big decisions differently. Our TTP system, I heard it being talked about a minute or two ago. Our TTP system has always been run as a public service. There are no consultants, it is not contracted out, no profits are made from it. We employ people who work in communities where the voice that you hear on the phone asking you to take particular actions are voices that you would recognize as coming from the part of the world to which you belong, and where you know that the reason the advice is being given is not because there is any profit to be extracted from it, but because that is the best public interest advice that those people who work in the public services can provide. Our vaccination program was the most successful in the United Kingdom reaching more people more quickly than any other country. And once again, it's because we have been able to operate through an NHS that is still absolutely recognisably in Wales a public service, publicly funded, publicly delivered in the public interest. And we were able to mobilise that very quickly, and it obtained an echo in the lives of people in Wales who came forward in such large numbers to get their vaccination, to keep the appointments that we've offered them. And once again now, in the latest booster campaign, we have the highest take-up of any part of the United Kingdom, reaching more people more quickly. Today, we've completed the vaccination of all our care home residents, all our care home workers, and we're well on the way to completing the vaccination with boosters of our healthcare staff and our health service staff as well. Let me just give you a couple of other contrasts between the way we have acted and the way the UK government has acted. Back in the autumn of last year, about now, Wales went into our firebreak period earlier than any other part of the United Kingdom. Prime Minister is fond of peddling the untruth that the firebreak period in Wales did not succeed. In fact, objective analysis of things by the London School of Hygiene and Tropical Medicine concludes that the Welsh firebreak was the most successful of any of the 4 UK nations, simply because we followed the advice of SAGE. We went early and we went deep. We had 2 weeks in which, we had a genuine lockdown in Wales, and that delivered everything that we could have asked of it. And we've continued in that way ever since. We've never, ever adopted the rhetoric that the Prime Minister is always prone to fall for, that sort of vacuous optimism. It'll all be over in 12 weeks, it'll all be over by the autumn, it'll all be over by Christmas, it'll all be over by Easter, it'll all be over on Freedom Day. And actually, as we know, it's not over at all. And alongside not adopting that rhetorical approach to a public health disaster, we have continued to keep in play those simple measures that collectively add up to making a real difference. So most of the things that are on the Prime Minister's B list in England are part of what we already have and already do in Wales. We still have and always have had mandatory mask wearing in public transport and crowded indoor places. We continue to urge people to work from home wherever they can. We require the use of a COVID pass in particularly vulnerable settings. I attended the Wales-New Zealand rugby match on Saturday. Probably the best thing that I can tell you about it is that 70,000 people turned up there, all with their COVID passes ready to show, and it was a very, very smooth operation. And I was told by a whole load of people as I was there that they themselves felt more comfortable in being in a crowd of that size, knowing that everybody else was either doubly vaccinated or had had a lateral flow test within a short period of attending. We're strengthening those measures over the next 3 weeks, and we still have the support of the Welsh public for doing so. When you use the rhetoric of Freedom Day, when you give people the false belief that somehow coronavirus is all behind us, then it's more difficult to persuade people to hang on to those things that they themselves can do. I attended Labour Party conference back in September in Brighton. It was my first visit out of Wales for many, many months. We stopped at a service station on our way down, and it really was, for me, a shocking experience. As I walked to the door of the service station, there was a very large sign in the door that said mask wearing is compulsory at this venue. Well, either they have a very large literacy problem in that area, or people have simply given up listening to those messages. Because as far as I could tell, the only people actually wearing masks were either from overseas or from Wales. And a very different experience that we still managed to sustain in Wales. So by continuing to rely on the contribution that Welsh citizens are able to make, willing to make, understand that by doing those simple things, they're not simply protecting themselves, but they're protecting other people from a virus that is still killing people every week in Wales. I think we go into the autumn and the winter, which will be a very testing time for our health and social care service, confident of knowing that when we call on the collective effort that really makes a difference, we're still able to do that. That the pact between the government doing the things we can do and our citizens doing the things that they can do remains intact and gives us the best chance of navigating our way through the remainder of this public health crisis in the best way that we're able to do that together. Thank you very much indeed. Thanks for the chance.
Thank you very much, First Minister, and thank you for showing sensible leadership and not employing a rhetorical approach to a very serious public health crisis. I'm actually quite jealous that I'm not in Wales, from Wales at the moment. Sorry. Our next speaker is Sarah Saul from the campaign group Safe Ed for All. It's great to welcome Sarah back to one of our meetings. Sarah and her colleagues established the campaign around the beginning of the pandemic in this country. Clearly, and despite government assurances, schools have not been safe. In fact, insisting that schools return without mitigation measures suggests to many that the government's aim has once more been herd immunity by infection in the schools. Sarah will speak to us about the current situation in the schools and her campaign to make them safer. Welcome, Sarah.
Hi, thanks, Nemo, and thanks again for inviting me to speak on behalf of Safe Ed. Since it's 7 o'clock, we're just gone. I'll try and keep things as short and sweet as possible. And I thought, in the same style as CBeebies, I would tell you a little fairy tale. So bear with me while I read you your bedtime story. Sitting comfortably? Here's a little fairy tale. So in March 2020, when there was still very little known about the global pandemic, the UK Department for Education gathered together a task team, which included epidemiologists, virologists, teaching unions, parent groups, pupil representatives, healthcare professionals, and psychologists. They worked together to develop scientifically recognised mitigations for an airborne virus, which would be needed for in-person education to be sustainable, safe, and fair to all. These main mitigations were ventilation monitoring and improvements, social distancing by reduced class sizes and small bubble groups, mask use for all that can have the fact that COVID is airborne explained to them and can be instructed in an age-appropriate way how to use good mask hygiene principles, and of course, enhanced hand and surface cleaning. It was acknowledged in March 2020 that implementing mitigations would require planning time and funding. The government provided the Department for Education with all of the funding required to implement all of the necessary scientifically recognised mitigations. It was understood that some aspects of education would need to be dramatically different for at least one academic year, perhaps 2, maybe even 3, to ensure that no child, no school staff member or their families were placed unnecessarily at increased risk of exposure to infection. So a streamlined national COVID curriculum was developed. Obvious priority was given to final year exam pupils and working out how they could finish their studies in a safe, sustainable and fair to all way. A focus on the streamlined curriculum was on safe socialising, on outdoor activities, mental health support. A national remote education resource was designed, funded and implemented. It used TV and easily accessible platforms to maximise engagement and availability. The National Remote Learning Resource is available to be used by any child whose parents chose to remain remote education during the first academic year of the global pandemic, whilst the vaccine programmes were rolled out. It was understood by all involved in education and indeed all involved in politics that these are exceptional times and discretion, compassion and choice were vitally important to parents, to children and to school staff. Schools were able to focus their attention on child welfare, community engagement, family support, whilst also ensuring that their staff welfare and safety was prioritised. Well-being of school communities was central to this new approach to education. Nightingale classrooms were in use to allow for social distancing for those who wanted to or had to attend regular in-person classroom settings. Anyone who didn't wish to wear a face covering or social distance due to their belief that no mitigations were necessary, they were also recommended to remain remote educating so that the safety mitigations were not compromised for the rest of the school community. While children who remained either wholly or partially remote educating were provided with regular opportunities to safely socialise with outdoor small group activities. The National Remote Education Resources were supported, created and featured some experts and celebrities such as authors, filmmakers, artists, comedians, actors, sporting professionals, musicians, chefs, presenters, politicians. The National Remote Education Resources helped to support and take some pressure off the teaching professionals who were quickly having to learn to adapt their teaching delivery styles to deliver blended learning and in-person and remote learning. Okay, story's over. Unfortunately, none of my fairy tale is true. We all know that. And with the release of the JCVI minutes late on Friday afternoon, it's increasingly provable that this government and the Department for Education have continued to pursue the scientifically flawed and ethically abhorrent strategy that was proposed by the Great Barrington Declaration advocates. It's a strategy that includes deliberately allowing a novel virus whose long-term effects aren't yet fully understood to infect our children, and in doing so, infect unnecessarily school staff and their family members too. UK schools were opened with little more than hygiene theatre, and guidance was issued not once, but twice for 2 separate academic years in both September 2020 and September 21, specifically designed to change nothing, to not adapt, to not innovate. And we're still reaping the results from the decisions not to mitigate and to mandate attendance. We have 101 dead under 18. They're not living with the virus. We have 53,000 long COVID kids. 11,000 of those have symptoms for more than a year. We have 1,000 plus child COVID hospitalisations a month. We have 8,000 COVID orphans. We have 570 dead school staff. They're not living with the virus. And we have 114,000 teachers with long COVID. This has to stop. The strategy must change from this current strategy of prioritising vaccinations for adults to a strategy of vaccinations for all age groups that are approved globally and mitigations for all. The mitigations have to be for all indoor settings where households mix. There isn't some magic bubble protecting the school setting. It's a setting where households mix. Those mitigations must be in place until the infection rates are reduced to extremely low rates domestically. So on behalf of Safe Ed for All, I'd like to reiterate what we say constantly. It isn't morally or legally acceptable to unnecessarily and knowingly expose anyone, regardless of age, ethnicity, gender, sexuality or occupation, to an increased risk of infection. So what we need to be asking, and what I'm very happy that Zero COVID now are asking, is how do we move on from continuing to state that this approach is wrong? How do we move on to altering the approach and having a safe, sustainable and fair to all education provision? Surely, in a democratic, socially responsible nation, we can prioritise education and health in tandem. There's best practice examples out there internationally. We're ignoring them. We need to stop with the British exceptionalist rhetoric. Stop with the excuses. Let's get this sorted. Thank you.
Thank you very much, Sarah. Thank you. Our next speaker, and dovetailing neatly, is Kevin Courtney. We are delighted to have Kevin back to speak. He was formerly General Secretary of the NUT, the Teachers Union, and is now Joint Secretary of the enlarged National Education Union for Teachers. Kevin can speak to us about the situation in the schools from the teachers and staff perspective. What are the priorities for his union and for the wider trade union movement in relation to the pandemic? Welcome, Kevin.
Thank you very much. And I'm as a Pontypridd boy, I'm thrilled to be on a platform where Mark Drakeford has just spoken, and also following your fantastic speaker just now. Now, we all know that vaccination is the way out of this crisis, but we also should all know that it's going very slowly internationally. It's going really slowly amongst children in England. And to some extent, it's waning amongst older age groups. So vaccination needs a helping hand. It's not enough by itself. And if you take schools as an example of that, then cases rising so fast amongst secondary children that they are the fastest rising group of all age groups, with primary children a bit behind, but still really high amongst the age groups, probably fallen back a little over half term, but will start picking up again as soon as schools open, from today when schools are open after half term. And those rapidly increasing case numbers amongst school children have real
Kevin, sorry, I think we've lost you. Kevin? Okay, we might have to get back to Kevin Courtney when he is able to join us again. Ooh, is he back yet? Okay, we're going to move on really quickly. To complete our trio of speakers focusing on education, pupils and their teachers, we're also very pleased to welcome back Vicky Blake, who is president of the UCU Union of College Lecturers. UCU members have been in a series of disputes since before the current academic year began. Some of those disputes have included issues of health and safety or working practices under COVID, or have been influenced by these issues. Vicky can give the perspective of her union in raising these issues for lecturers, staff, and students, and an update on the ongoing campaigns. Welcome, Vicky.
Hello, and thank you for having me again. I would say it's a pleasure to be here, but I wish these meetings weren't necessary. And I just want to thank all the other speakers as well for the really impactful and articulate way that each and every one of you has been explaining the problems that really, I don't think it's the case that the government doesn't understand. I think they understand all too well. And what we've got is a paucity of actually caring about what the science is telling us and what the facts on the ground are telling us. I was listening to the radio earlier about how we are at least 5 million deaths worldwide, and that's probably an underestimate. Cases are up here. We know what a disaster. We've spent much of this meeting talking about what a disaster the current spike in cases is, despite the vaccination programme. And we're fighting against this notion that it's only a cold, which is mixing very damagingly with, I think, the confusing information that people have been given, including from the absolute top by the government, about what mitigations are appropriate and what mitigations are necessary. And that's also mixing in with everyday ableism, which means that people believe that it's all over now, it's safe, if you get ill with COVID now, it's only a cold. And they ignore and forget those people who are now even more sequestered in their homes and unable to have contact with the outside world other than online than was the case during times where we had more precautions. Because as things have, quote unquote, opened up, we've driven up more cases. There are people who cannot, for their own health reasons, be vaccinated, or for whom even vaccinated, we were very worried if they got ill. In terms of the University and College Union, we represent staff across universities and colleges, as you might expect, but also in community and adult education and in prisons. And we have actually, as Nima said, we've been mounting disputes in individual branches for the last, well, since the pandemic began, over health and safety. And we have actually had a win at the Novus branch, which represents prison educators. That covers 49 prison branches. And we went into a dispute with an absolutely unprecedented strike. This is not something that members in prison education do very often. And we have recently won, I'm really pleased to say, but we should never have had to go on strike and take that level of action that went on for really quite some time in order to get basic, scientifically backed principles in place to help keep our members and also the people that they're working with, that they educate within prisons, that bit safer. It's absolutely abhorrent. And we should say thank you as well to the Prison Officers Association, who were very supportive to us during that dispute. In terms of where we are with the mess that we have over mitigations, I've spoken at these meetings before about UCU's 5 principles for coming back into more in-person contact, and how that needs very much, and we've pressed very hard to say it needs very much to be underpinned by multi-layered mitigations. So we're not talking about, oh, brilliant, lots of people have been vaccinated, that's it, that's all fine. We're talking about maximising vaccinations and doing everything we can to make them more accessible. We're talking about mask wearing in indoor spaces, and also making sure that ventilation is appropriate. And as I'm sure lots of you can imagine, the sorts of buildings that our members are teaching and working in colleges and universities in particular, they're often quite old. They're not necessarily built with ventilation in mind. Some of the windows are there but don't open. It's that kind of situation. We've been pressing for CO2 monitors, but no one measure on its own is enough. And the science is there, and we've been speaking about it since the beginning. But with the government's real insistence on ignoring and sidelining the narrative about how COVID is airborne, something I don't think we can say often enough, so I'll just say it again, COVID is airborne. We just aren't seeing the responsibility being stepped up to by our employers on a uniform enough basis. And I think that's been reflected across other sectors. So we really need a mandate in place for things like wearing masks in indoor spaces and crowded spaces, if you are able to. Obviously, there are some exemptions, but by and large, most people should be expected and indeed mandated to wear these masks. Now, in some institutions, we have actually pushed employers to the point where they have agreed with us and they have required masks to be worn. And so that's testament to the organising power of our union members on the ground. But again, it's a fight that I don't believe they should have had to mount, because the government has abdicated all its responsibility here. We opened up too quickly after July the 19th, and the evidence is before us in the numbers and in, the pressure on our NHS. In my family at the moment, we have a medical situation with a very much loved member of my family, and it is being complicated by coronavirus, and it is being complicated, and we see it written on the faces of the medics who are helping us care for this member of our family every day. And they are, I'm absolutely certain, doing the absolute best that they can, but they too are being put on the front line without the kinds of protections that they deserve and they need. And we are now quite a long way into this pandemic, and we have seen repeated evidence that the government does not really care about making sure that we are all safe, does not really care about further education, because if it did, we would have seen much more progressive attitudes taken towards it in the budget, does not really care about the reality of what it's like to work in higher education. And by extension, if the government does not really care about the conditions of its workforce within further and higher education, then it doesn't really care about the conditions that students are learning in, because our working conditions, and we say this a lot, are students' learning conditions. We had a survey that told us today, that came back with the results, that the levels of depression in the sectors where we represent workers is absolutely through the roof. We already had quite an epidemic of mental ill health amongst our workforce because of the severe pressures of workload, of casualisation and insecure work, and of inequality of pay and conditions on the ground. But the pandemic has absolutely exacerbated that. Our members have pulled out every stop have run on empty and then run on fumes to keep education going, to support students as best they can. We've had our members outside halls of residence taking food supplies to students who were locked in because what was provided by the universities wasn't adequate nutrition for them. We have had endless examples of students struggling when they should be better supported and there should be better provision in there for them. But our staff are also struggling from a severe deficit in mental health provision and support. And actually, many of our members are people who are employed in support roles, in counselling roles, who are there to support students, but are themselves not being supported well enough. So we still take the position that employers do need to step up across the board. But underneath and behind all of this, we cannot have the government trying to abdicate their responsibility by pointing at employers that they themselves are not supporting. We need better funding that actually means something on the ground, that actually translates into a proper accessible education. And that means making sure as well that that education is safe as safe can be, that we have measures mandated, that people do not have to try and guess whether or not the latest news on masks is right or wrong, that they are not there puzzling over why some government ministers have said one thing at one time and another thing at another time, that they need to see our elected representatives in their place of work wearing masks, that they need to see that it's required wherever people are able to wear masks until this thing is brought under control, and that ventilation and the ventilation of buildings of all ages is something that is meaningfully addressed in a structural way. So I'll finish on the note that anyone who has read the JCVI minutes recently will probably have thought that Halloween was, being writ large, because it was an absolutely appalling thing to read. And it is very, very clear why those minutes weren't released at the time that they should have been. And a lot of people who were saying at the time that the government was again going back to this idea of hybrid immunity were being dismissed. They were being told that they were being conspiracy theorists, again going back to this narrative that it's all over now. And you can understand why people want to believe that and why people will latch on to those who were telling them that it's all over and everything can go back to normal. But it isn't. And it's very clear that those people who were raising the alarm were not just being, conspiracy theorists. This was not fake news, that really the government has again failed. And I believe that we will look back at this time and wonder how on earth it was allowed to fail so comprehensively and for so long. I could go on for really quite a long time about this, but I won't do. But I think that we really need to focus on how we support one another. We are still balloting in higher education. We've got our ballots open for the next couple of days over 2 different matters, which, although they're not explicitly focused on coronavirus, you can very much see the interlinking of the issues with how we have been treated within those working environments and the way that we are treated, over COVID. And that lack of regard for people's physical and mental well-being is as obvious in the responses, or the not sufficient enough responses to coronavirus measures that we need in place uniformly across the sector, as it is in the way that our pay has been eroded, our rates of insecure work are through the roof, our workload is, it was bad before the pandemic. It is so much worse, and we are trying to do so much more to support students who are paying astronomical, unfair fees at the expense of our own health. So all of these things coming together, we are really very angry, but we are doing practical things about it, and we are organising on the ground. And I would urge anyone watching this who's not in a trade union to find out what union would be most relevant to you. You can look that up on the TUC website. Join that union and get involved in the branch and ask what is happening about risk assessments, what is happening about pressure on the ground to keep people safe. Because, we're talking about at the moment how worried we are about the delays to the post because so many posties are off sick. There are concerns in every single sector about how many people are off sick and how many people are being affected long term. And I'm just going to finish on the note that we are not only talking about death here, we're also talking about life-changing impacts on people's health, including the still not very well understood long COVID. And I know others have said it here, that the impact of that on adults is not fully known, and even more so on children, not fully known. And the rates of that are truly alarming. So it's time for change. Thank you.
Thank you very much, Vicky. Yes, it is definitely time for change. I think we've got Kevin back now. Can I have Kevin Courtney?
Hi,
Yeah.
can you hear me?
Yes, we can hear you.
I'm sorry, I don't know what happened there, but I've been listening to the other speakers while I've been offline, and just really want to agree with what Vicky said about if you're not in a union, then join one. And it just took me back to January the 3rd this year, when the Prime Minister was on the Mar show saying it was safe for schools to open. He was going to open every primary school, apart from some in London, the very next day. And we knew that it wasn't safe. And we had an online meeting of 40,000 of our members. We know that 400,000 people watched it over Facebook, and we advised our members to send in Section 44 letters. And as a result of that, most schools didn't open the next day. And the Prime Minister was on the TV that night saying schools were vectors of transmission. Being in a union really matters. But before I was cut off, I was saying that cases were going up really fast in schools. And that is actually really disrupting education as children stay off because they're positive and we're not doing enough to control the cases, or their staff, their teachers stay off because they're positive. And some of them are double vaccinated and have very little symptoms or no symptoms, but they still have to stay off because they're positive, and that's still disrupting education. And it's also disrupting the education of the children who have symptoms which go on longer, whatever the consequences of long COVID that we don't know about. Like Vicky said, one of the consequences is you're often off school and your education is being disrupted. And it's not just those in-school disruptions. We can see from the data that if secondary schools are the group that are going up fastest, then the age group that are 30 years older than them, their parents, they are then starting to pick up as well. And again, most of them don't get the disease very bad because they're double vaccinated, but some of them do, and they're being hospitalized as a result of it. And as Mark Drakeford said, that's then taking up the space in the hospitals. And it's then not just the people in because of COVID, it's that is displacing people who've got cancer or other long-term illnesses, and they are failing to get the treatments that they need. So that's terrible. I think what's worse is that we know there are things we can do about it. We're particularly pointing to the fact that cases, I haven't seen data recently, but while cases were rising fast in England, cases in Scottish secondary schools were falling. So there's a difference, and it's worth looking at the differences. And in Scotland, there is still a mask mandate in secondary schools. Gavin Williamson got rid of it in schools in England. He was just being macho. There was no good reason to get rid of it. The mask mandate is still there in Scotland. There's another difference. In Scotland, if your brother or sister tests positive, you have to stay at home for 3 days, then get a PCR test. You can only go back to school if you're negative. In England, if your brother or sister tests positive, you're back in school the very next day. There's some vague hope that you'll have a PCR test, but it's a really big difference. Now, that sounds in Scotland they're disrupting children's education. The children who are close contacts have to stay off, but actually the net effect is less children off school in Scotland than in England, despite the fact that those very close contacts are being held off. So there is something we can do about it. Scotland has also been better on vaccination. So we're calling for the government in England to do the sensible thing and do at least what the government in Scotland is, to see if that gets cases falling. But there is so much more that they should be doing. The sorts of things that Safe Education for All and Sarah have been calling for. There should be bubbles, not necessarily to send bubbles home, but to stop the virus spreading from one group to another. It should be clear that we shouldn't be having whole school assemblies, for example, where the virus can spread throughout the whole thing. We should have the Prime Minister on telly calling for lateral flow tests. We've now got the NHS calling for it, but the Prime Minister should be fronting that up. Most of all, well, all of those things are most of all, they should be investing in ventilation and filtration where the ventilation isn't good enough. Like Vicky said, COVID's airborne, and ventilation really helps to reduce these things. Those things, most of those steps are no disruption whatsoever to people's everyday lives or to their education. They reduce disruption to education as well as reducing the total amount of virus. Those are steps we should take. I would just also want to associate myself with things that some other people have said. We need to allow countries in the global south full access to every part of the vaccination program, including waiving the patents. It is disgraceful that our country is one of the countries that's blocking that. We need test, track and trace to be in the public sector, and we need people that are ill to have definite guaranteed access to sick pay so that they stay off if they get tested, if they're positive or they're a close contact with somebody in that sense. Those steps would really get us through this. Vaccination is the way out, but vaccination needs a helping hand, and the sorts of measures we're talking about on this call are that helping hand, and our government should be implementing them.
Thank you very much, Kevin. So we've already heard from some of our speakers about the issues related to some of the at-risk or vulnerable in our society. So it is extremely important that we are able to hear now from Emma Kelly from the campaign group Fighting for Vulnerable Lives. The campaign was founded in response to the end of shielding and the removal of clinically extremely vulnerable and clinically vulnerable status. Emma will be able to tell us about the current threats to those who were previously able to shield, who now face a much more vulnerable future, and what her campaign's priorities are. Emma?
Hi, thank you so much for having us. First of all, I really want to start by making it very, very clear, because our government stopped speaking about us. The general public don't think of the term CEV or CV. So CEV, clinically extremely vulnerable. CV, clinically vulnerable. The ones that have always been forgotten are the people who are on the diagnostic odyssey and don't know where they stand, but have clinical vulnerability that were never, ever put on the list. CEV status was removed from our CEV. Shielding was removed from our CEV. Freedom Day came, and with it robbed our freedoms. I speak to hundreds of CEV around the country all the time. People are terrified right now. We feel in more danger now, 19 months into this pandemic, than we have felt at any point in this pandemic. All our supports are gone, our understanding is gone. There's no information campaign to the public to tell the public what we need. We were used as a scapegoat for lockdowns and for safety measures. We are treated as a minority in this pandemic. We account for over 60% of the deaths. And what people don't realise is us CEV and CV, we are of all ages. Our CEV children are struggling to access the vaccine. Some have managed to have the first vaccine. Many haven't. The ones that have are now too far apart from the recommended time for their second vaccine. For a lot of our CEV children, winter is a very dangerous time, and we have our winter routines to protect our children. We've only 322 ICU beds in the whole of the UK paediatrics. Now, as a CEV, I have a CEV son who has been in paediatric ICU 6 winters he has had in paediatric ICU, and I know how precious these beds are. Opening the schools and letting COVID rip through, and knowing the number of children who are now being hospitalised a week and our paediatric ICUs are filling up. The trauma a family go through with an ICU stay, what our children go through, there's no support, and there hasn't been support, and there is no support coming by the looks of it. We cannot sit back and allow any more children to contract COVID. It is entirely preventable. There are mitigations we can use. Our children expected into school, whether they're CV or they come from a CV family, but no child should be expected to be subjected to contracting COVID. We know there's 35, well, I'm get it right, is it 53,000 long COVID kids right now in this country? That number's growing every single day. Do we really feel okay knowing that these children, many of them, will actually be classed as CEV and CD because of the damage long COVID is causing to their little bodies? This is their futures. Us CEV know what it's like. Don't get me wrong, for a lot of us. So I always had my winter routine. We used to go into medical quarantine for my son. And we would go into medical quarantine from October right through to the April. And that was to protect him from anything that was going around in the winter. So we're used to this in our house. And for a lot of us, this is quite a normal practice. For a lot of people who become CEV in the pandemic, they never once thought their lives were in danger because of their medical condition. It was brand new. Never once did they imagine that their life could be limited. And there was no support. What we're finding now is the vaccine rollout for the boosters is an absolute disaster. We have families who have got multiple people in their homes who are CED. And what's going to happen is, because none of them are actually getting their vaccines at the same time, they're going to have to be in a continuous circle of shielding a family member, because none of them, the child can't access it in time, or the mum can't access it in time, or dad can't access it in time. And what actually happens is, because our transmission rates are so high in the community, they're just continuously having to shield somebody. We have had people in shielding from March. I've been in shielding since February because we were in medical quarantine for my son. And there is no understanding for us. There's no support. We need our schools safe. And the things that we can do for COVID are actually legacy benefits. They would actually be legacy benefits for attendance. They would be legacy benefits for health. And not just for clinically vulnerable children or medically fragile children, for all children. Schools are driving transmission, and our kids can't access the vaccine. Our NHS is on its knees. We cannot access safe medical care right now. I know CED people who are not attending hospital when they need to because they just do not feel safe. And still, we are left with not a word from our government, like we do not exist. This can't continue. We need our GPs to be given the right to invite who they know, their patient, that relationship, the clinician and the patient, they should be given the power to invite forward the people who need the vaccine. And this is not happening. And the vaccines are being blocked. The vaccines aren't a silver bullet out of this. We need the mitigations put in place. What kind of winter we've got ahead? Our CV are terrified, absolutely terrified. And there's no support coming. There's no acknowledgement. We have got children going into school today knowing they have got a CV member of family at home, or knowing that they themselves are clinically vulnerable, and they are absolutely petrified. Where is mental health support? The JCVI made it very, very clear in their minutes, which has devastated our CED. I know, absolutely devastated our CED. Reading those minutes, knowing that our children were meant to get COVID and pass it on and bring it home. But where's the mental health support to get through this? Fighting for vulnerable lives are fighting for everybody. We don't want anybody to contract COVID unnecessarily, develop long COVID, and become clinically extremely vulnerable. It's an incredibly lonely place to be because you are treated as if you don't exist. but there's over 5 million of us at last count, and we know this number grows every day to a new diagnosis and new treatment started. Please don't think you're alone. Reach out for help and support. We're here. And to the general public, we're relying on the kindness of strangers. If somebody's wearing a mask, don't ridicule them. If they've asked for a bit of space, could you step back? Could you maybe understand that for them, going to the shop is like Russian roulette? We need some empathy back. COVID's not over. Thanks very much.
Thank you very much, Emmy. And yes, totally agree. Fighting for vulnerable lives is fighting for everyone. It's fighting for us all. And in any crisis, it's always the most vulnerable and the most marginalized who are at the greatest risk. So I'm very pleased we're able to hear from Francesca Humi of the Status Now network. This government's terrible policies on the hostile environment have collided with its disastrous policies on the pandemic to leave migrants as among the most vulnerable of all. Status Now for All is a network of organizations and labor unions calling for indefinite leave to remain for all undocumented migrants and those in the legal process living in the UK. Francesca will be able to characterize the current situation for migrants and talk about their campaign priorities. Welcome, Francesca.
Thank you, and thank you very much for having us. So yes, I'm Francesca Humi. I'm the Advocacy and Campaigns Officer at Ganlungan Filipino Consortium, which is a signatory and member of the Status Now for All campaign and network. So basically, following the outbreak of COVID-19, undocumented migrants and those advocating for their rights came together to call on the British and Irish governments to immediately grant status, such as indefinite leave to remain, to all undocumented, destitute, and migrant people in the legal process. This call was motivated by the understanding that migrants with insecure or limited immigration status would have limited to no access to state support, such as healthcare, housing, and other social support, including food, despite the urgency and danger presented by this unprecedented health crisis. So who are undocumented migrants? Undocumented migrants, or those with insecure immigration status, or those who are in the legal process, are migrants who do not have valid leave to remain. People become undocumented due to many different reasons. Their visa may have expired and they could not renew it. They may have been prevented from renewing it due to prohibitive Home Office and legal fees, or due to a change in professional or personal circumstances, or maybe because they did not know that their leave was expiring or that the legislation surrounding their status was changing. I work with Filipino migrant women who become undocumented after being trafficked into the UK as domestic workers, and when they flee their abusive employer, they lose their right to remain in the UK. Some become undocumented after leaving abusive partners on who they depend for their right to live in the UK, for example. And some become undocumented despite being born in this country or coming here at a very young age. It's really important to emphasize that undocumented migrants are everywhere in British society, but are often unseen or ignored. Undocumented migrants care for your children and your elderly. They cook your meals, they clean your streets and your toilets. They provide frontline work in a variety of sectors. Like all migrants with limited or no leave to remain in the UK, undocumented migrants have no recourse to public funds. This means that they are not eligible for any government support, including shelters for women fleeing abuse, and in some cases, free school meals for children who don't have leave to remain in the UK. They also have no right to rent, meaning many live in overcrowded or precarious accommodation. Undocumented migrants I work with and support tell me of the intense fear they live under. One of my clients told me she spent 2 whole years without taking the train or the tube because she was so scared of immigration enforcement. Some have not seen a doctor in years, again out of fear of data sharing between the NHS and the Home Office, or because GP surgeries ask about immigration status when they try registering. Some do not maintain meaningful or intimate relationships because they are so scared of others finding out about their immigration status and of being reported as a result. However, it's also really important to emphasize that undocumented migrants are incredibly resilient and survive the and survive the government's hostile environment policy through tireless solidarity and care for each other within and across communities and networks. The pandemic has had a devastating impact on undocumented migrants. The issues I've just identified were worsened by the pandemic, and in many ways, the experiences of undocumented migrants as marginalized people foreshadowed the destitution experienced by hundreds of thousands of people in the UK during the pandemic. Many undocumented migrants lost their jobs without eligibility for support like the furlough scheme or even sick pay if they were ill. Some who lost their jobs also lost their housing as they worked as live-in carers or domestic workers. Some were unable to self-isolate due to overcrowded housing or lack of income to allow them to stay home without work. Undocumented migrants have been at the front line of the fight against COVID, whilst also being the people most vulnerable to the pandemic due to lack of social and public health safety net. Those who were not registered with GPs remain unregistered and did not seek medical help, even when infected with COVID. As a network, we received multiple reports of undocumented migrants dying of COVID, alone at home without any medical treatment because they were too scared to go to the hospital. Their blood is on the hands of the government, which failed to act for their protection when we called on them to do so. The exclusion of undocumented migrants from a public health perspective makes no sense. COVID is not over, and the issues that have been pushed to the front due to COVID are still here. On November the 11th, COVID passes will be required in social care settings, for example, and booster jabs are already being rolled out. The considerations made for undocumented migrants during the rollout of the first few doses of the vaccine have not been guaranteed again. So for example, allowing people to get their COVID jabs without a GP registration or NHS number, ID or proof of address, this has not been guaranteed again, and people might become excluded again with these new measures. Working towards a zero COVID society is an act of solidarity and resistance with the most vulnerable, which includes undocumented migrants. We remain glad of our inclusion in the Zero COVID Coalition, which is an inherently international movement because of its global implications, which is why the experiences of those who exist across and outside nation states, like undocumented migrants, is so important. And as a final reflection, because I know we're coming to the end, COP26 has just kicked off up in Scotland. The pandemic and the way it has treated the most vulnerable, marginalized, and disempowered offers a stark and terrifying preview of what we can expect for migrants coming to the global north due to the climate emergency, if this government and other Western governments do not change their immigration and public health policies. You can find out more on our website, and you can join as a signatory and as a member of the campaign. Thank you.
Thank you very much, Francesca, and everybody at Status Now. Unfortunately, Ben Chacko, co-convener of the campaign and editor of the Morning Star, was unable to join us this evening and sends his sincerest apologies, which makes Francesca our final speaker this evening. Thank you all for attending. A special thanks to all of our speakers, to our technical team for making it happen, and a special big thank you to all of you for watching. I hope you found it as informative as I did. Thank you.